In 1900, the United States was very different. While ideals of democracy were taking root, access to basic necessities, including healthcare, was far from equal. This video will explore the challenging journey of healthcare in the United States, taking a closer look at how it has and hasn't evolved towards becoming a more democratic and inclusive aspect of our society. It'll not only delve into the roots of today's problems, but come up with a solution in order to create an equitable healthcare system. Beginning of the 20th century, healthcare was basic and very often inaccessible. Medical knowledge was still developing, and as a result, effective treatments were finite. As you can see, access was largely determined by wealth and social standing, so lower-income families were dependent on charity or just went without the care they needed. Women's health was repeatedly overlooked, and the needs of the LGBTQ+ community were almost entirely invisible within the healthcare system. President Teddy Roosevelt passed the Pure Food and Drug Act in 1906, which was a crucial first step in regulation, but it didn't address the fundamental inequalities in healthcare access. In the 1920s came early steps toward government involvement in healthcare. The Shepard-Towner Act of 1921 expanded funds for maternal and infant health. As the Great Depression emerged, hospitals faced major financial strain, and access to even basic healthcare services became a struggle. As we know, FDR's New Deal programs created great reform. The Social Security Act of 1935 provided grants for maternal and child health services.
The right to adequate medical care and the opportunity to achieve and enjoy good health.
Truman picked up where Roosevelt left off and advocated for a national health insurance program. In the mid-20th century, there was a rise in private health insurance. The promise of the Hill-Burton Act to expand hospital access was unfortunately undermined by segregation in this era. The Medicare and Medicaid Acts of 1965 were significant steps toward inclusivity as they provided funds for the elderly and lower-income families. Not only did President Johnson sign the Medicare and Medicaid Acts into law, but he also took a role in the establishment of neighborhood health centers aiming to provide care in marginalized communities. Following LBJ's presidency, President Nixon responded to the concerns about rising costs with the Health Maintenance Organization Act of 1973, aiming to promote HMO development. Cancer research was also encouraged within this decade. Regarding women's rights in healthcare, Roe v. Wade was a decision by the U.S. Supreme Court that acknowledged that the Constitution protects a woman's right to have an abortion. The HCFA was established in 1977 under Jimmy Carter, accentuating the federal government's role. In the late 20th century, healthcare prices soared and the cost of insurance premiums became increasingly unaffordable. The lack of universal healthcare meant that many remained underinsured or, better yet, uninsured. Women's reproductive rights became increasingly politicized, and the healthcare needs of the LGBTQ+ community began to be acknowledged, though very often met with discrimination and lack of understanding. Presidential influence has been very present in the 21st century. For example, in 2003, George W. Bush signed the Medicare Prescription Drug Improvement and Modernization Act, adding prescription drug coverage to Medicare. Barack Obama signed the Affordable Care Act, or Obamacare, in 2010, aiming to expand health insurance coverage and reform the healthcare system. Trump sought to withdraw from the Affordable Care Act because it represented excessive government regulation to him, and Joe Biden worked to strengthen and expand the Affordable Care Act and to address healthcare disparities. States with restrictive laws regarding one's ability to get an abortion raise questions about bodily autonomy and gender equality these days. LGBTQ+ healthcare has been enacted in certain states, however, it is far from universal and we still have a long way to go. My vision for the future is wide, and it consists of expanding programs such as Medicaid and the Affordable Care Act in order to benefit lower-income families and decrease the cost of healthcare for average citizens. We need to increase funding for research on women's healthcare and LGBTQ+ healthcare. That way, care for women will be more readily accessible, and the LGBTQ+ community will be more understood in the healthcare environment. Additionally, we need to prioritize patients over profit because every human deserves to receive the care they need regardless of how much it costs. By making these systemic changes to our healthcare system, less people will be under or uninsured, healthcare will be more affordable and accessible, and there will be less discrimination for certain groups of people. Ultimately, fixing our healthcare system is not only the responsibility of policymakers, but it's also our responsibility to be engaged, informed, and advocate for a system that reflects our values of equality and inclusivity. Thank you for watching.